My poster discusses a comparison of moral distress between nurses and physical therapists and occupational therapists employed in a skilled nursing facility. In 1984, Andrew Jameton described moral distress as a situation that arises when one knows the right thing to do, but institutional constraints make it nearly impossible to pursue the right course of action. Moral distress can result from the perceived loss of personal and/or professional integrity due to the inability to achieve or sustain professional standards for the best outcomes for a patient, or to act as an advocate for a patient. It is vitally important that nurses and therapists with extensive geriatric knowledge are retained in their role and are able to provide quality care to a patient population that has more functional and cognitive deficits, thus needing more time and resources than the typical patient. Moral distress is a substantial problem for healthcare. It can lead to many issues and problems. Quality of care and patient safety may also be negatively impacted. This was a quantitative, cross-sectional, descriptive design study utilizing the MDSR and the MDSR 21 OTA. Each item is a 21-item Likert scale survey tool assessing 21 clinical situations. Moral distress contributes to negative consequences for healthcare with decreased job satisfaction and work productivity, increased turnover, and burnout. In this study, 46% of the therapists and 32% of the nurses had reportedly left a previous job due to moral distress. Level of experience was found to correlate with higher levels of moral distress. And age was not a factor in impacting the mean composite score, frequency times intensity of moral distress for the therapist. For the nurses, age was a factor. Younger nurses reported more moral distress. The importance of interprofessional relationships needs to be introduced during educational and training programs. The implementation of interprofessional collaboration and learning to work together and respecting one another's perspectives in healthcare will ultimately help improve patient safety and quality outcomes.